Yes, we do have a waiting list. We serve 34 counties, and we can serve 511 individuals at one time. In one of our counties, we have 125 on the waiting list, and another county, we have 75 on the waiting list. And we are hoping that what happens is when a person rolls off, we add another person on. When one rolls off, we add another person on.
We had average about 100 senior aid we had at any one time, and then there are waiting lists, no question about it. Waiting lists usually come from, they get off is you get a job, they're off, right? But the one who don't get a job are the one who prefer to stay. But you have a time limit for that too. So how do you get them out is really hopefully you place them. That's why we put this component in, making sure that the one who need a little extra help, a little bit of holding hand, get the holding hand, and then they will get off so the waiting list can move on. Otherwise, it is tremendously difficult to kick people off if they don't get a job, because the whole idea is to help them from community service angle. So it's a combination of things, making sure you hold them hand, the other one to push them out too. Not push them out, pull them up.
Jane, you had a question that Adrian?
I wanted to do a story about different ways that seniors could find jobs or training after what age do you start? What could you call it?
55.
55 and older. You help the underserved. Then where do I go to find out who helps the middle class? Is there a similar, I'm ignorant on this.
For the most part, it's through the Workforce Investment Act and the so-called one-stops in every community that's funded by the Labor Department. But the troubling story behind that is if you look at the latest figures from the Labor Department, I think about 40,000 people 55 and over of any income get any training in the entire country.
Right.
So it's a very small fraction of what historically has become a smaller and smaller program.
Nothing really organized, like you're organized to help the underserved. There's nothing organized to help the middle class. So
at least funded by the federal government, no. It's the closest thing would be the Workforce Investment Act program.
Let me add a component too. Since we deal with the family in the totality, sometimes the individual senior may have very low income in that sense they qualify. But the sons and daughters may be the middle class. But in fact, if you don't help the family in that sense, it becomes a burden for the middle class too.
Yeah, right.
So in that sense, especially elder, the caretaker.
No, I was just trying to do a broader story.
Right. So in that sense, we find the most effective way when you totality of the family, you see how we are actually a component of the larger family issue. It is the middle class too. But then particular issue are addressing the senior, otherwise been left out.
Right. Adrian had a question.
Two questions. Even though you have a waiting list, how do you recruit, and do you continually recruit, and how exactly do you go into the community and get people to know about it and respond to it? And the other, which might be related, is do you have any entrepreneurial programs for people to learn to start their own businesses and maybe even partner together to get off the list?
The entrepreneurial piece of that, in our particular agency, we do not have that component. There are, I'm aware of, in many areas in the state of Pennsylvania, there's a lot of agencies collectively across the state that do run entrepreneurial-related senior grass cutting systems, painting companies, things of that nature to help them get them started. That's fairly well out there. We don't ourselves run that. As far as the recruitment piece of it, a lot of times it's coming from the other agencies, the other nonprofits that are aware that the program exists and is available within the community, and they're basically contacting us. We've only been a grantee now for 2 years, so we're not as well entrenched in the system per se as maybe some of the other recipients here in other areas, so I'll let them speak to that.
We don't have an entrepreneurial program as well. And for us, we've been doing this since the early 70s. And so it's word of mouth. The nonprofit agencies were well respected in the Memphis and Shelby County area. So much respected, and we have done a great job. 2 years ago, Senior Service America looked at us and said, okay, we need to do some expansion. There was a competitive bid at that time. And because we have done such a great job in the past, we were awarded, we started with 2 counties, and now we're doing 34 counties. And so
Just in the state of Tennessee.
Just in the state of Tennessee. But pretty much it's just been word of mouth. The other nonprofit agencies and the governmental agencies within our area know who we are, and they just call us and have people. But the entrepreneurial piece is a pretty interesting piece that we may need to start looking at.
You won't feel a grant coming on here.
I know, I know. Another innovative grant.
You want to know more checks for us?
Yeah, that's right.
Right. Well, I think in getting to the recruitment piece, about a year ago, I guess a little less than a year ago, as one of the things we do in support of our sub-grantees is we bought some commercial radio time and ran ads in areas where some of our sub-grantees were having some trouble in recruiting eligible people. So we'd be happy to share the radio ad that we developed. We also bought print ads in local papers, again, it's targeted. We ran it here in Washington, D.C. The feedback we heard from our sub-grantees was very, very positive. The other thing I would say, though, about recruitment is that despite the fact that there's over $500 million that's supporting CSEP throughout the country, it's present in almost every county in this country. It's still serving at most 1% of the total eligible population. So what the grantees, not just us, but all the organizations that are responsible for running the program, they have to be careful about giving a lot of effort in terms of recruitment, because you can't, it would be really frustrating to let the word out and really then end up with a waiting list of 1,000 people that in the end you wouldn't be able to serve in any realistic period of time. So what most of the grantees do is sort of coordinate their recruitment at times when there are vacancies.
Okay.
Actually, I want to, no foundations here, right? Otherwise, I don't give away with my thinking. There's a lot of potential, but it's entrepreneur, depends what niche you get into. For example, 1099 is entrepreneur, right? 1099 is available now to home care workers and child care, family care providers. These doesn't need to lift weight. These are people responsible, 55 over. You can do that. There's a niche in there. If you can train them into family care providers for the children and also for the caretaker, the elder, to respite for the caretaker. This is an area that increasing Medicaid, for example, home care, are looking into. And those are areas, if you can train them into it, they can take care of it. It's entrepreneur. It doesn't really take a business to start a business. But there are, we work on some level in the family care providers for the children. Like the state will provide $1,000 starter fund, so you have the basic kit, and then you do the training and you match them up to individual. And these are the areas we see because we do comprehensive stuff. We understand those niches, the demographics and the needs. Those are areas that have wide potential in there. But again, you got to find a niche and link up. And a lot of time it happens in the like you said, is word of mouth situation. You know where the potential, where the people are, and the opportunity comes, you can match them together.
We're going to have time to take one more question. Ruth, you had another question?
Yeah, there were two questions I had. One was, has anyone done any kind of comparative study of the health of these people versus the health of people who are waiting or not working or gainfully employed? And, well, I'll just leave it at that since you have time constraints.
Well, the short answer is no. But the closest empirical research that has been done is related to this customer satisfaction survey, where there's a specific question that asks, how is your health the same or better than you were before you entered the program? And I'm sorry we did not share that. I'll be happy to give you a copy of that report. One of the things that we've done supplemental research on the national data collection on that. One of the things that we are most interested in doing, in fact, our organization is working closely with the Gerontological Society of America, and that is to try to stimulate more research on CSEP participants and again, examining the impact of participation as an aging program, that is on well-being. And in fact, I'll invite everybody here, Judith Gagne, the Boston University School of Social Work. She and I are giving a workshop, what time is it? 1:30 in the Thurgood Marshall Ballroom North, and we're going to be looking at what little data there is about impact on health.